call this Board of Health monthly meeting to order on Wednesday, February 11th. They meet in Colorado.
Daniel Chenoweth.
Present.
Jennifer Locke. Present. Charlene Martin.
Good. Welcome, Charlene, to your first Board of Health meeting.
Thank you.
We are a small but mighty board, and we're happy to have you join us. For those in the audience, Charlene is the new City of Champaign Township Supervisor by appointment of the board. I would take a motion to approve the agenda.
So moved.
I'll second it. Any discussion or additions? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of minutes of the previous meetings. This is the just January 14th, 2025 monthly meeting. I'd entertain a motion.
So moved.
I have a motion, I'll second.
Yeah, I think we both said so moved.
Okay, motion, second. Any discussion or corrections?
No.
All those in favor say aye. Aye. Opposed, that carries. Next, we have public participation. Is there anyone here from the public who'd like to speak to the Board of Health? Okay, next we have correspondence from our new administrator. Welcome. I mean, you've been here for a while, but congratulations and welcome to your first Board of Health meeting as
Thank you.
administrator.
Thank you.
We're happy to have you.
Thank you. Very grateful to be here. So we sent a few correspondence about Incredible Mind and Soul. I think those were some of the items in the agenda last time that needed more clarification in my mind. So we just send those. That Soul is a platform that allow us to have an outreach for a segment of the population that's really difficult to reach. And these are Black, African American, 55 and older. Just wanted to give an update on that. The second update is the Incredible Mind. I think that also is a platform that provide mental health articles and podcasts that allow people to take care of themselves and have a healthy well-being mentally. So we just wanted to make sure that that platform also is accessible for the community. So that's why the flyer is here. But I think in the description there is 10,000 articles that people can read about self-care and well-being. So just wanted to give a quick update on that. I don't know if it's time for me to give an update in general, but
Yeah, this would be
okay,
good. Yeah,
all right.
go ahead.
So a quick update on fundings. So we yesterday we got notified of a funding cut for HIV testing and hepatitis C testing, but for I believe 5 or 4 states, democratic state targeted funding cut. So specifically for us in Champaign County Public Health District, so that funding cut does not affect us a lot because the funding allocated amount was $34,000, but we only use this funding for a fee for services, meaning that when we do testing for HIV or confirmatory test for hepatitis C, so when we send it to the lab, so we pay the test for those with those funding. So basically, there's no the funding cut does not affect us as people might see in the news. So I just want to give a quick update on that. In terms of personnel and staff, so there has been a few changes that I've made. So there is our PIO, Public Information Officer, who sit under our wellness and health promotions. So I moved that to the administration so that we can have a direct relationship, but also provide all of the division to have access to that and not have a one division oversight on the PIO. And that was the same concept that I did for our I-Plan And our I plan, I'm glad to report today, or happy to report today, that we got certified. So our I plan got approved by IDPH during the week. So we are fully certified, but I also removed the I plan specialist from one of the divisions to admin. So we have I plan specialists that report to admin and also PIO that report to admin. But that doesn't mean that they're siloed under one division, so all the division can interact with them. So just want to give that quick to update about staffing and funding.
And the PIO is, you said, Public Information Officer?
Yes.
So is that the person who does outreach and communications, or is it a FOIA officer, or?
Yeah, great question. So it's the Public Information Officer. So this is the person that does our press release.
Okay.
They also do marketing marketing and communications. So they build out flyers for different divisions, but also making sure that our social media platform are monitors for content.
And then just on the iPlan, I used it recently. I was looking through iPlan data for a presentation Charlotte and I did this afternoon. And I noticed that it wasn't called, is it like the iPlan that we did, was it any different than past iPlans? Was it like an interim or a light kind of iPlan? It just seemed to have a different name and different focus than others. So I was trying to understand.
Yeah, so it's no different. Usually, we call it's under the umbrella of iPlan, but it's basically the community health assessment
Yes,
and
that's what it's
community
called.
health improvement plan.
Okay.
But for Illinois, they just put that in
I see. So same name,
Yeah,
just a
yeah.
different brand for the same thing.
Yeah.
Yeah, I found it to be very helpful.
Yeah, it's our incredible staff have been working on that. I don't want to take any credit on it. So I think that our division directors and staff have been really working hard on making that happen, and I'm very happy to report that we got approved. And so we use those certifications for our grant application. So any grant application for the federal and state, we have to probably submit those to see to show that you are eligible for those grants.
And then when I was doing research, I noticed that there's like a data dashboard
Yes.
now on our website.
Mhm.
And I wonder if there's something, not now, but if we could set aside a time where the board could kind of walk through that dashboard.
Yeah.
So that we're able to kind of be ambassadors for people using it. It seemed really helpful.
Yeah.
And I just feel like I had heard that it was in progress.
Mhm.
I didn't realize it was there.
Mhm.
And yeah, I would just be interested in learning more.
Yep, we'll take note on that and we'll schedule something.
Okay. Other questions for our administrator? Okay. Thank you. Next we have, we don't have old business, new business, presentation of the audit by Sikich.
It's me. Do you want me to stand on the
You
podium?
can do it wherever it feels comfortable for you.
It doesn't matter to me. Okay, I don't know if you all have copies of the audit report, if you've seen it and things like that, but I'm gonna kind of walk through it briefly, hit the highlights for you.
It's in our packet.
Okay, good. So first off, on behalf of Sikich, I want to thank everybody for inviting us to present the results of the report for the audit for the fiscal year ending June 30th of 2025. I am going to focus first on the bigger report, which for us is the annual financial statement report. We'll go through there and then see if we want to continue on to the others or if we've had enough audit yet. Okay, so starting on page 1 is the independent auditor's report, which is kind of the purpose of this whole document is for us to opine. Our opinion is governed by 2 main boards, which is the AICPA, the American Institute of Public Accountants, and they set the auditing standards for us, which gives us the procedures we need to follow when conducting the audit. We also have another board to worry about, which is the Governmental Accounting Standards Board, and they set the financial reporting standards, so they say what needs to be into this report. So given that, we review the financial statements as they are, and we issue our opinion, and for this year, our opinion is that It's considered an unmodified opinion, which means that the financial statements fairly present in accordance with generally accepted accounting principles in the United States of America and also the government auditing standards. And then the next opinion you guys actually get two, because this is a double report because it includes our single audit report. So on page 4, we discuss the other reporting that's specifically required by the government auditing standards. When the district expends greater than $750,000 in funds, in federal fund expenditures, they're required to have what we call a single audit, which is a compliance audit required by the federal government for the district's use of the federal funds. So in the back half of this report, you kind of get a double report situation where we give you a couple other opinions that are required to be presented with this single audit. So for the year, the district expended $4,083,421 in federal funds. So that required these additional opinions. First one is the independent auditor's report on internal control over financial reporting and compliance and other matters in accordance with the financial statements prepared in accordance with government auditing standards. That is also an unmodified opinion, both on the internal controls of financial reporting and the compliance and other matters. There's also additional reporting on the back here where we identify which programs we tested as major programs for the audit year. Your major program was the HIV care formula grants. There were no findings or question costs that need to be presented related to that. So now I'm going to kind of touch on the financial figures just briefly of the beginning of the report. So I'm flipping back, if anybody's following along, to page 5 here. There's going to be 2 sets of balance sheets I present and 2 sets of income statements I present. So the first one is called the statement of net position, and this is essentially your full accrual economic resources statement. So this statement is designed to see if the district operated as a full business, what would it look like? And so this will have your capital assets on there, and it's also going to have your liabilities, which then kind of summarize your long-term liabilities. But these for you guys include mostly your compensated absences, your OPEB, your SPIDAs, and your leases. And then I'm going to go to page 6, which is kind of the income statement companion to that report, which is your statement of activities. Now you're going to see this is kind of a little different than you're used to because we have this change in accounting principle in the middle of this. So GASB decided they were going to pass a statement they call 101, which is related to compensated absences. So previously it only accrued if it was related to vacation because you guys would pay that out if somebody separated from the district. GASB has decided they want an estimate of any sort of leave that people could take during the year, whether you guys pay it out at the end or not. And so that caused us to have to accrue additional sick leave back, which is why you see that negative 606,345 there. So for the year, your change in net position, according to this income statement, was negative 501,319. However, we go back to the next page, which is your second set of balance sheets. And these statements are presented on a modified accrual basis, which is the current economic resources. So this is kind of more what you would use in your everyday decision making.
Which page are you on?
I'm on page 7.
Okay, so you were just looking at the, like 6 was unmodified.
Yeah. So,
Okay.
so the unmodified opinion is the opinion page, which is all the way back on 1. But the pages 5 and 6 are the ones that are on that full economic resources. So those are the ones that will have your capital assets, your long-term debt. And it'll give you a different picture.
Okay.
And then you'll kind of see when we go a little bit later, there's a couple of reconciliations that reconcile between these 2 sets of financial statements that occur. And I'll kind of touch on those briefly. Sorry, I tend to go fast a little bit here.
Well, can I just
Sure.
So when I look at 6,
Mhm.
and certainly we get our financial update, and I know that there were some areas we were running under. Am I correct in understanding that basically looking at expenses by department and then income, whether it be fee for service or grants, that basically we ran, we basically spent 6.35 million more than we brought in last year.
But see, that will not account for at the bottom here. You got those extra revenues related to taxes. And so
Okay.
that's another 5.8 million.
I
that
see,
gets
so
put in.
this is pre-tax income.
Yeah, and then you get the
Got
taxes.
it, if we're just looking at grants. Okay, great, I was trying to understand, I was like, and then you have the taxes coming in,
Yeah,
then you have a total tax is about 5, which is where you got your 501 in loss.
Yep.
So basically, we ran like $500,000 loss last year.
So this is where you're gonna kind of get confusing. So these expenses here, this is also gonna include your depreciation, your change in OPEB, your change in IMRF, like changes in things that don't normally affect your day-to-day operations, which is why we then present the second set of statements that I'm gonna go into now.
I thank you for bringing me up to speed. I wanted
sure.
to make sure I was following along with you. So now I am with you.
Yeah, so we kind of glaze over these statements a little bit more because this is not going to really affect your decision making as much as the next two statements that we'll talk about, because it's going to eliminate those things that are kind of more non-cash and a little bit less relevant, if that makes sense.
Yep.
So page 7 is the balance sheet that comes from that. So you see there's no capital assets now, there's no long-term debts in here, but most of the other things that retain are just your receivables. So this is more of like a current look at your financials, and here what we're focused on is making sure that you have positive fund balances here. So like in your general fund, you have a positive fund balance of about $7.7 million, which means that you have a fairly good reserve system.
That's what I understand.
Yep. And so then when you see page 8, so when you look at that kind of page, that's going to show you the differences between essentially page 5 and page 7. So all those extra things we have, like the capital assets, a little bit of the estimates related to the IMRF and the OPEB and things like that. So then page 9 is more your income statement that you're kind of used to from your day-to-day operations. And that's going to show you everything without all those extra things in it. So for that one, you'll see your net change in balance in there is a 1.168510 in the positive direction. So you didn't actually overspend, it just had to do kind of with those adjustments. And you'll see page 10 will take you from that 1.6 figure down to that 501 and show you what caused the difference. And you'll see most of it relates to changes in that pension liability and things that don't kind of affect your everyday, day-to-day operations. So then the rest of the audit, starting at page 11, is just like the summary of the accounting policies, and then additional schedules related to like your budget versus the actuals. I don't typically present those. If you want me to go into anything specifically related to those, I can. Otherwise, that would conclude my presentation related to the annual financial statements. And then we have 2 additional reports to look at, and we usually will not go into detail into the last one, which we call our CIPHR report, which is the Illinois Grant Accountability and Transparency Act. So we essentially issued this report so that you're able to upload all the reporting that you need for the state of Illinois, and we have to opine kind of on that report that then gets uploaded, and there was an unmodified opinion on that as well, so I'm not really gonna go through that whole report there. And then our final report is this auditor's communication to the board of directors, which is up to you all and management. So this report, I'm going to skip a bunch of pages on this. So page 2 of this report is where I'll start, which is that's where we have to communicate some things to you. There was no new accounting policies otherwise than that compensated absences policy that we covered before. This is if we had any disagreements or difficulties, we would say that here. There were no disagreements, there was no difficulties during the course of preparing the audit. The staff was very helpful. We got all the information that we needed. We got it all in a timely manner, so there's no other issues there. Only one small journal entry. And then your management letter is on page 7. And there was no material weaknesses or significant deficiencies to note on the management letter, so it was a clean opinion. And then the rest of this report kind of goes into future GASB pronouncements, which I will not go into here for you because I think they're boring for me, so I'm sure they'll be boring for you.
It's actually all thrilling.
Well, nothing big is coming in the future, so that's the good news. I think our last biggest number one was the one that hit right now for compensated absences. The next couple are just kind of reporting things here and there, so nothing I would expect that would affect the district. Does anyone have any questions?
If not, I would entertain a motion to put the audit on file.
So moved.
This motion, I'll second it. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Thank you so much.
No problem. Thank you for having me. And I'm
Drive
going to
safe.
depart and try not to be too noisy doing it.
Next, we'll have the treasurer's report.
It's not gonna be any more exciting.
It only gets exciting when we're doing poorly, and we prefer to not be very exciting, so.
This is as of December 2025, so the end of the calendar year, but just halfway through our fiscal year. We showed cash on hand of $7,873,873. The total fund balance was just shy of $7.7 million, representing 42% of the budgeted expenditures for the year. That's within the 25 to 50% guideline of annual expenditures in cash. We ended the sixth fiscal month with a deficit of $869,936. That's against a budgeted deficit of $1.4 million. Our income for the first 6 months, we had total revenues of $7.3 million, or $966,000 under the year-to-date budget, primarily due to grants and contracts being under by $738,000 and fee-for-services by about $200,000. We had total expenditures of $8.2 million, or $1.5 million over budget for the year-to-date fiscal. A portion of that was personnel of $401,000 being under budget, fringe benefits by $149,000, contractual under budget by $486,000, and patient care under the year-to-date budget by $180,000.
Any questions from? I'd entertain a motion to put the treasurer's report on file. A motion, I'll second it. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, I'll take an omnibus fashion approval of payments of Board of Health appointees to Treasurer Ron Fields for January 2026 services, and to Attorney Ruth Wyman for legal services from December 16, 2025 to January 15, 2026. I'd entertain a motion.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have review of monthly credit card statements. Any questions about the credit card statements? They start on page, yeah, there you go. I can see the number. 99. If not, I'd entertain a motion to put them on file.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of executive assistant job description. This is, oh, there's handy page numbers there, 105. It's a new job description. Why don't we entertain a motion? I'll entertain a motion, and we can have discussion.
So moved.
Second, any discussion? Dr. Tonkara, if you could just explain the new position.
Yeah, so for a long time, the idea to bring a new assistant executive was in my mind because most of the workload for the board is taken by Amy, and Amy's role primarily is on HR, doing onboarding and following up with payments with staff, and then also IMRF staff. So I just feel like we had a discussion, and she voiced concern about if we can find someone to help her do that because of the workload. But beside that, I also feel like for our internal meetings and also my personal meetings, that it would be really nice to have someone who can manage all of that. Another argument that I have in mind also is our contracts and MOUs and also grants, that we need someone who can track all of those to see when the renewal is, and also making sure that those are properly on file. So not that it wasn't done before, it was, but it just organizational wise, I think it would be very beneficial for for us to have an assistant. Another argument that came to mind also is that since we're not planning to hire a new deputy,
We are not.
no.
That was my next question.
Yeah, so
Okay.
we're not planning to do that, and And I think that having, you know, an assistant will really help, not only admin, but also coordinate with all of our division about organizational, you know, stuff. So I just feel like it's very beneficial to have an assistant that will coordinate all of that and also take some of the workload gradually, because I really trust what the work that Amy does. I told her that I'd be very skeptical about bringing someone in, but you know, the transition has to be very smooth. She has to train that person to make sure that we're really good and make sure that the work flows smoothly. So, but that was some of the reasons that I think that it would be very beneficial for us to have an assistant here.
And so no deputy at this time, and what's the salary range, and will it be open hire?
So right now, I think the idea is to hire this person on our administrative assistant 3, which is the highest. And then the idea is that when we bring this person in, there shouldn't be much training and oversight. You know, we want to bring someone in who's ready and have experience in doing this work. Because I think it's really crucial for organizations like ours to find someone who's, you know, trustworthy, but also have the skill set to manage that. And I know that, you know, from personal experience, that it's very crucial to have an assistant to help with those work.
And it'll be an open hire?
Yeah, open hire, internal, both internal and
Yes,
external,
external.
like you guys
Yeah.
have approved before. But we took a step forward, one step above that. So we want to also hire a company, external company that tests these people, like the top candidate, just to make sure that their skill match what we really want, not only a verbal, you know, interview.
Yes.
So.
Okay, that makes a lot of sense. And you might want to, just having hired for positions that are similar, to do like, make the salary range assistant 2 to assistant 3, because you might find somebody who has less than 5 years, but is really more of a fit with the organization. So I just encourage you to think about, you can always go with, yes, 5 years or greater, but it opens it up just a little bit.
Yeah.
And you can bring somebody in with a little bit less salary, if that is the right person for you.
That's a great idea. I think we haven't set the salary yet, but this is just us brainstorming.
Okay.
Where like, if we want someone who's very skillful and have experience, we probably have to give them higher salary, but the decision hasn't been made about the salary.
No, understood. But I think for these skill sets, you might be able to get somebody with 3 years that is a really good mission fit, you know, organization. So, any other questions?
I just want to voice support for it. I think that with the early retirements that are going, the institutional knowledge that's going to leave the doors and not ever be allowed to come back, or it endangers their retirement. I think that having someone to check the boxes and do everything while the culture builds back up all of that institutional knowledge is a great idea. So full support, and all of the reasons you listed are fantastic too.
Thank you.
Any other questions or comments? Okay, we'll take a vote. All those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, we have approval of check request payable to, and I'll take this in omnibus fashion, Metokio for Atlas and basic subscription, Cronus Sashir Inc. for UKG Ready, DECA improvements for office remodel, and entertain a motion.
So moved.
Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of MOU between CUPHD and Healthy Champaign County for IDPH fiscal year 26 Healthy Resilient Communities Grant, and entertain a motion.
So moved.
A second? I second it. Any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of renewal of malpractice professional liability coverage. I'd entertain a motion.
So moved.
Second, we have a motion, a second, discussion. All those in favor say aye. Aye.
Aye.
Opposed, that carries. Did I miss something?
Thank you, Bob. I was
Next
we
is
didn't have
Edward.
anything in the paper. We didn't have anything in the packet about it.
I haven't
We're
received
renewing.
anything back from the
Okay.
underwriters yet.
Same company?
Same company, we've been with for 7 years, and it is due for renewal on February 27th, so I needed to get it on the board meeting.
Yes.
However, they haven't got back to me on any cost or anything like that, so
Okay.
when I get that information, I can send that out individually if that's acceptable.
Sure. I think we took
We did take a vote.
Okay. Next, we have approval of community partnership agreement between Community Choices, Inc. and CUPHD. I'd entertain a motion.
So moved.
Of a motion, is there a second? A motion and a second. Is this for them to have placement here at CUPHD? That workforce development placement?
No, it's for outreach and education programming.
For people with intellectual?
We go there and do education for them.
Got it. Any other discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of proposal from Patterson Dental to purchase equipment for the nitrous oxide grant. Entertain a motion.
So moved.
A motion, I'll second it. Any discussion? Do we do an external RFP for it?
So I think
It's
we,
small.
yeah, we.
Oh, is it a small amount? I was sorry.
$7,065.
Oh, okay, yeah, sorry, you wrote it down.
I did, yeah.
Oh, that is really,
$7,065.
that's great, I'll just ask you from now on. Never mind, I have answers to my question, it's under the limit.
No, the limit is actually 5,000.
Oh.
It's above the limit.
Oh,
But we
okay.
just, for this specific one, I think that since we have been doing work with them, we just thought that down. But we are open to.
Okay.
I'm
That's
open to
helpful.
raising the limit.
Yeah, actually, I thought the limit was 10,000, so that says something. Okay, any other discussion? Did we have a motion and a second on the table? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of letter to the Illinois Fund signatory designation. I'd entertain a motion.
So moved.
Second. We have a motion and a second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of resolution 2026-0201, approving IMRF authorization, authorized agent. I'd entertain a motion.
So moved.
Second, any discussion?
Danielle, if I can.
Yes, please.
The last time we sent something to IMRF, it was on the early retirement, and they required us to read it out loud in the meeting. I don't really understand that, but just if you're willing to do
Yeah.
that, it might save us some time.
You want dramatic reading? Okay. I can do dramatic reading.
And it has to have a roll call too.
Okay,
Please.
I will do that. So I'm gonna read out loud Resolution 2026-0201, resolution changing IMRF authorized agent. Whereas Champaign-Urbana Public Health District, Champaign, Illinois participates in the Illinois Municipal Retirement Fund, IMRF, and is required to appoint an authorized agent who shall have the powers and duties set forth in section 7-135 of the Pension Code, 40 ILCS 5/7-135. And whereas Julie A. Pride was appointed to the IMRF authorized agent and terminated her employment with the board on February 2nd, 2026, which was a retirement. And whereas the board desires to appoint a new IMRF authorized agent to replace Julie A. Pride, now therefore be it resolved by the Board of Health of Champaign-Urbana Public Health District, Champaign, Illinois, as follows. As of February 11th, today, 2026, the IMRF authorized agent shall be Mamadou Tonkara. The IMRF authorized agent shall have the following powers and duties as required by section 7-135B of the Pension Code, 40 ILCS 5/7-135. 1, to certify to the fund whether or not a given person is authorized to participate in the fund. 2, to certify to the fund when a participating employee is on leave of absence authorized by the district. 3, to request the proper officer to cause employee contributions to be withheld from earnings and transmitted to the fund. 4, to request the proper officer to cause district contributions to be forwarded to the fund promptly. 5, to forward promptly to all participating employees any communications from the fund for such employees. 6, to forward promptly to the fund all applications, claims, reports, and other communications delivered to him by participating employees. And Lastly, 7, to perform all duties related to the administration of this retirement system as requested by the fund of the governing body of the district. Section 3, the attached notice of appointment of authorized agent Exhibit 8 hereto is hereby approved and shall be executed by the appropriate persons and submitted to IMRF by the board secretary or designee. Section 4, all resolutions or part thereof in conflict with this resolution shall be repealed, and this resolution shall be in full force and effective immediately upon its passage, adopted this 11th day of February 2026 by roll call vote. Yours truly, the chair of Board of Health. And is there any discussion about said resolution? Now you know what you do as a IMRF. You will also be an IMRF. Yes, so now you know it's like outlined here very clearly and in legalese. Okay, I would take a roll call vote, please.
Danielle Chenoweth?
Yes?
Jennifer Locke?
Yes.
Charlene Martin?
Yes.
Great, that extremely important retirement fund resolution is great. It is a big responsibility. 13, pending grants contract for the administrator to sign. Is there, okay, between CUPHD and Illinois Children's Healthcare Foundation, ILCHF, for reducing barriers to care, implementing nitrous oxide sedation in a public health dental clinic in the amount of $28,658 for the dental division for the period of January 1, 2026 to December 31st, 2026. I entertain a motion to allow the administrator to sign this.
So moved.
Motion and second, any discussion? All those in favor say aye.
Aye.
Aye, opposed, that carries. Our next monthly meeting is my son's birthday. Hopefully maybe.
You could bring your son.
can be here. What?
You could bring your son. Happy birthday.
That is not what he wants to do. I did ask him tonight if he wanted to come, he just thought it was crazy. March 11, 2026 at 5 p.m. And with that, we are adjourned.
Danielle,
Right.
what do you know about the